Good morning, and thank you for the invitation to the first Czech Positive Psychology Conference. It really started in Prague 2 years ago, and it was Alena Slečakova who made it happen, that Martin Seligman came to Prague together with me and Gunter Loega, and I'm very, very happy to see maybe one of the results. Here are more than 150, more than 180 persons, and this is a good sign for positive psychology. And you are happy to hear me first. You know why? Because my English is the baddest English you have ever heard on a conference. Yeah? I speak like this Austrian governor in California, because he was also Styrian. And you can be, it's too loud?
I'm very sorry, but the mic does not work well.
Okay, so this is better? Yeah, okay. Yeah, okay. Now you start to become unhappy because you have to hear my English. Yeah? Okay, and I only can say to you, it becomes better during the morning. Yeah, because all the other presentators are speaking a better English than me. So I have the honor to present a study of positive psychology, the design of a study of positive psychology interventions for depressed people older than 65. We have the luck, and I think it's one of the first projects in the world to do it, to do this together with a psychiatric hospital, and this I would like to show to you a little bit. Some words about the first points, and then I will explain a little bit in detail the program we try to do with these older people, and I want to explain these 4 units. So, what is the aim of the study? Yeah? We try to investigate the effectiveness of a positive psychological program of interventions based on the PERMA theory of Martin Seligman, which I will explain short a little bit later on, in a clinical setting for depression, people with depression aged over 65 years. We want to look if this maybe works better with these people than treatment as usual. So, what is well-being? You have a lot of ideas. What is happiness? As we are on a university, you can read the books. I want to try to explain what Martin Seligman means with well-being, and he means 5 essential points. Your life is flourishing if you are able to fulfill more or less 5 points. First of all, positive emotions. If you are able to have more positive emotions averaged in your life, and you can feel more positive emotions than negative emotions, then you have probably a high degree of life satisfaction. Barbara Fredrickson, professor from University of South Carolina, says you need a 3-to-1 ratio, 3 positive, 1 negative. I made the Fredrickson test 2 weeks before. I had a 1 ratio, 1 positive, 2 negative. So I have to work on me, but this thing from Barbara Fredrickson is this questionnaire is very, very interesting to see. But it's clear, if you feel good, you probably live good. The second one is engagement. Engagement means to use your personal strengths rather than to use your personal weakness. Normally, we always try to reduce what we don't, where we are weak on. Yeah? we are not so much concentrated, we cannot remember so much things, so we do a training and a training and a training to become not so weak. And the idea, not only of Seligman but also of Csikszentmihalyi, is use your strengths to develop. And so it's probably more easy, and this is the third component, have positive relationships in two ways. You can live good and successful if you have a social network around you. This means family, good friends, people to speak. The most helpful thing, if things are complicated, is if you have a possibility to talk to somebody. And you have also a possibility how to talk to somebody. You can talk to somebody nice, or you can say, what you are doing here? Oh no. I very often talk with my son not in a very constructive way, and I always have not such a good social network with him. If I would be more friendly to him, yeah, and I say, why you haven't done this? If I would say to him, nice to meet you, very nice, oh, some little compliment. Seligman calls this active, constructive reacting, and I think this is one of the most important things, and I think positive relationships is one key issue of Burma or well-being. Fourth is meaning. Meaning means you should have something in your life what is a little bit bigger than yourself, some project what is a little bit bigger than yourself. And best are things, research shows, things which have to do something with pro-social action. And the last thing is accomplishment, that you can fulfill a goal of yourself, but only for yourself. I never understood what Seligman meant with this, till I finished an 8-kilometer run in Amsterdam, 2 minutes under my goal, and then I knew with my over 100 kilos what accomplishment is. I made it. Yeah. So, some components we were looking at, what you maybe need for a well-being in age. The first one is, Lehr says it, activity and participation. If older people are active and can participate in life and are not isolated, they can do very much. So the most easy thing is probably to let them help to educate the children of the children. Next thing is positive self-concept and self-control. If older people are able to control themselves, to manage their life by themselves, this is a very interesting thing for well-being. I know it with my mother, who is 88. She is still able to go out for lunch, for dinner, has a lot of friends. This self-management helps her a lot and probably reduces the depression. This comes from Sonja Lubomirsky and is general. If you are in control of that what you are doing, if you are drawn by the future and not driven by the past or driven by the circumstances, you probably have a better life. And Van Hoven says, psychological well-being influences psychological health. This is quite clear, and this is very, very clear in old age, and very important. Shortly, how positive interventions work, in my opinion. Positive interventions are no therapeutic intervention in the classical sense. They work through action. Positive interventions are things you can do in everyday life. And so they cause solutions. And they cause solutions for people who are already depressed and who are not able to find a solution when you say to them, okay, let's say some magician is coming to you during night time and everything will be away of your problems. What will be the next morning? And they say, oh no, I don't know. No magician will visit me anymore. Here you need probably a clear intervention, an exercise, and they can cause solutions. They work over the power of action because you have something to do what you can easily fulfill. And this is probably one of the reasons why they work, because they break through problematic patterns and make it unable that they can exist anymore. They create maybe not directly the solution, but they create something new, and so they can. So it is possible to develop something new. And this is probably one of the biggest strengths of positive interventions, that they are so simple that it is already a crime to give them, because they are so easy to understand and they are very easy to implement them in everyday life. But it is not it's no therapeutic art, if you know what I mean. It's simple. Yeah, you just can do something what you can even do if you are in a very bad mood. So we thought the requirements for interventions for older people are easy to handle. They should make activity possible. They should correspond then to different cognitive statuses, because we know that the cognitive performance in older ages is going back a little bit. I feel it already with me, you know. You hear my English, yeah? And my wife still refuses to treat me because he is a geriatric psychiatrist, so I am in good hands if it goes on with me. So it should appeal to different sensorial, physical and mental areas, so they should go to every part of the human being, and they should empowering more or less automatically social contact and communication. It should be make possible what with older people very often and depressed people very often is not the case, a revival of the senses, that they feel something anymore, that they come out of the distance where they have gone. They should be appropriate to age, and they should be adaptable to a clinical setting, which was a big challenge to have it, because it's not so easy to have it in a hospital. So now, just do a study design. 120 participants, 60 for the experimental group, 60 for the control conditions. We have in such a study to exclude somebody, and we will exclude all people with a mini-mental status lower than 25. So we exclude dementia. So that we have real depression, light and mild and moderate depression, not really severe depression. And this we do with the mini-mental status, with the clock drawing test, and with the depression in old age scale, what we also have during the study. We will have a pre-test, a post-test at the end of the program, and a test 3 months after the offset of the interventions. The measurements of well-being are the satisfaction with life scale from Tina, the scale of positive and negative experience from Tina and Beaver's Tina, the positive and negative effect schedule from Watson, the flourishing scale from Tina, the Rift scales of psychological well-being, and the measurement for depression will be the depression in old age. We choose these scales because they are quite easy, quite short, easy to understand. You cannot give people over 65 269 questions. So all these measurements have 10 to 20 questions. And for sure it would maybe have been better to have one PERMA questionnaire, but we don't have up till now one PERMA questionnaire. We have these questionnaires and measurements and instruments from Tina, and I think they fit very good, and the Rift scales come from a little bit different theoretical approach, but we also check it what will be there. And now you see an animated studies design here. Pre, post, follow up, randomization of the groups after we tested everybody, then we do a randomization in a control group and the experimental group. This is in German Versuchsgruppe. Test point 1, test, yeah. Positive psychological program of interventions, treatment as usual. Treatment as usual is coping, stress therapy, coping, and relaxation therapy, cognitive behavioral therapy. And we do this program for 2 weeks because these 2 weeks is the normal duration these people stay in the hospital. And then we make a post-test after these 2 weeks. In 3 months later, we make a follow-up testing where people come in or where we visit the people. These are the hypotheses, very short. The happiness index should go up. The life satisfaction index should go up. Positive activity should go up. Flourishing should go up. Psychological well-being should go up. Depression should go down. Okay, we will see. Yeah? You will have the PowerPoint available. I pass it over to Alena, and you can have it. And this is now the programs, and this is probably one of the key works. We use 4 units. The first unit is dealing with 3 blessings and appreciating communication, RCR. The second unit, use your strengths. The third unit, be grateful. The fourth unit, enjoy. And be active and come into contact with others. And I allow myself to introduce this to you because this is maybe quite interesting and also quite practical. The first unit, we start with 3 blessing and appreciating communications. There will be a group of 8 to 10 people. This we know not so very exactly because this is a little bit changing in a hospital. And we start with a little round. People sit around. And the first exercise is make compliments. Yeah? To everybody, make 2 compliments. Try to make 2 compliments. What we feel here, you will see the first results, not on a diagram, but what I can report. This is sensational what happens. Then there comes a question to the group. In which situations I act positive and interested to others? The second question, always given in German and adapted to the group situation. How do I react in a positive and joyful way to others? And then we try to define rules of appreciating communication together in the group. And these are the elements. And I don't, because my English is so bad, you better can read it. No? Yeah. So, then the second part of this unit lasts normally 60 to 90 minutes. The second part of the unit starts with a question to the group. Do you have thought already about something positive today? Do you have already thought about something positive today? What happened to you? It was a good thing to come to the conference. Maybe, yeah? It was a good thing. No, okay. Huh? Okay. Yeah. Then we introduce to this 3 blessings exercise with more or less these sentences, yeah, where we try to explain that normally people try to focus on the negative things. Yeah? The conference is good where I'm attending today, but I come late 5 minutes, yeah, so the day is over. Yeah? Or you say, fortunately I come late, so I missed Dr. Streit, yeah, and his bad English. And then comes the question for the group. Who can tell 3 good things that happened in the last few days? And then we give them a happiness diary. A happiness diary is a little booklet where they can write in everything. It is a little folder where everything is in, where are sheets in of whole the program, and we help them to make a photo on it. We make a photograph, a little drawing inside if they want to do. They can individually enter their names and so on. And then the task is for the next 3 weeks, and they will be supported by the nurses and the helpers in the hospital to write in, take some minutes every day and write down what made you happy, even if it is a bad day. Write down something what you can feel good about it. We not say write down what you have done good, because this makes stress. We say write down what was good for maybe a visit from a relative or something else. And this works fantastic. The nurses who are also in the morning rounds, I said, this is the first time since years we had no, oh, it is all so bad, oh, no, it will not go on, because they speak about nice things, yeah? They speak about their child, about their grandchild, and so on. They speak about things at home, about their interests, and this is one of the most effective changes we see immediately in the group. And then comes at the end, if it is possible, if not, we do it in the next unit. There is a 20 items questionnaire where they prepare for the strengths unit, and the next unit is the strengths unit. The unit starts again with a round where everybody is reading out of the happiness diaries. We did this with pupils and we do this with the older people. It's sensational what comes out here. No? Not everybody is reading something, but a few, and we do it every unit, and they read always a little bit more and a little bit more. And the other should not react, no, this cannot be what you know. This is not okay what you are reading here. They should try to react active, constructive. And then comes the question for the group. Do you feel somewhere strong? How strong are you? That's the first preparation. Then we go into the topic of strengths, about this instruction. And our experience is, if we don't have some offers in the room, which kind of strengths are possible, they say, I am patient, I am not tired, it always comes the same. So you need some offers, yeah? And we use the offers of the Seligman virtues, yeah, of the Seligman virtues, and it helps very much because people get an idea what can be also a strength for themselves. And then we ask the group, we discuss with them these questions, and then comes out a very interesting thing from Maya Storch, a Swiss psychologist from Zurich. She has sensational pictures of resources, and we let the older people choose one of these pictures. There is a lion, a sail ship, a waterfall, a flower, and this is the picture for their strengths and for their goal. And they should find one of the pictures, and they get this picture then in a color copy, and this is the picture for their goal and maybe for their project. And then we write down with them together their own strengths in this happiness diary, and we start to speak with them about a personal project. Make something what is a little bit bigger than yourself. We speak with them about a personal project, so that when they leave the hospital, that they have a thing to do. Maybe it is only go back to your girlfriend you meet every 2 days. Go back to the sanitary club. Get back into contact with your relatives. Do something with your grandchild or something else. And this we start here. The third unit is gratitude. We start again with the diary. Then comes the question to the group. when did you give thanks to somebody? And this is a very interesting question, because if you are depressed and negative, you never think about to thank somebody. Yeah? And so we start this. And then we introduce to the topic that we think if you can say thank you to somebody, you maybe didn't say thank you up till now, it is very, very nice. And this is what our experiences is with the older people. They normally live alone in a big room, also in the hospital, and then they start to thank to somebody in the hospital. Yeah? The colleague or the woman who is next to them or the man who is next to them for something little kind thing. And then we try to explain it to them, and then we ask them further on in this unit for what you could be maybe grateful in your life. For nothing, I'm depressed now, everything makes no sense. But then you see, sensationally, they had a big life, yeah, because they had something to tell, maybe about the war, maybe about the development in Austria, maybe about the development in the village, and so on. And where are you grateful? And then comes the exercise. Take some minutes and think about where you can be grateful. And who wants to do it, because this is a complicated task, can also write a letter of thanks to some person where he didn't express up till now his thanks or his gratitude. And it could also be in the project that he sends his letter of gratitude or gives his letter of gratitude to the person. The fourth and last unit is be active and come into contact. Start it the same, read from the diary, do something and so on. Prepare, and then the next thing is to prepare an enjoyment table with gifts, which comes from the cognitive behavioral things to smell a little chocolate, some spices and so on, that it is possible to enjoy. The questions for the group is what you can enjoy in what situations. And this is also amazing what you here find, because this makes contact to the sense. I need 2 minutes. Yeah? What does it mean to enjoy? Which feelings you have while enjoying. The next thing is be active and come into contact with others. The question for the group is where you have been involved, and this is only dedicated to planning the last issue together before they leave the hospital, a personal project. And we try to work it out with them very clearly, very properly, so that every person who leaves the training program has an idea what he can do and what he is able to do. With his picture of strengths, with all the resources he got, he should do and try, and we check it 3 months later. And we recommend to them to continue the happiness diary, and then they go back home and they get contacted 3 months later. What was a big theoretical problem for the study, but we decided just to put it in that we will contact everybody. And for sure you have a problem, but we have first results, and we can do more precise if we have first results. The first experiences are the discussion about strengths and free presence changes the group atmosphere. The gratitude is very powerful. The exercises about strengths works best in combination with visualization. The personal project seems very, very helpful, but it needs a lot of attendance. And first results, what we have done, and also a little bit calculated, show what most of the studies of positive psychology show, the degree of depression goes down. And the happiness index scales up till now don't go up significantly, but this is also the result of all the positive therapy studies, but we are happy to do it, and I am happy that I had your attendance. This is the literature. Maybe you can take something out of it. Thank you for your attention.